Hi, everyone. My name is Dr. Alana Arnold. I am here to present to you a program from Parent Partners. I'm really happy to share this with you. It is about respiratory illnesses during the winter season. This is very, very common in kids and leads to a lot of hospitalizations and lots of unwanted ER visits. So, this webinar is going to tell you everything you need to know to get you prepared and kind of walk you through what's going on when your child is getting sick during the respiratory season. This program is called Winter Colds and Wheezes. It's a guide from Parent Partners, so let's get into it. I'll give you a brief overview, and then we'll get started with the content. So, first off, we're going to just do an introduction to the respiratory illnesses. We're going to talk about asthma, RSV, which is a virus that leads to bronchiolitis, something a lot of people have heard about in the past few years, and then the flu. I'm going to talk to you about COVID 19 as well and how it kind of presents a little differently in children. And then we're going to take time to talk about strategies you can start working on to try to stay as healthy as possible during the winter season. And then finally, when to seek help, which is very, very important. And lastly, when you need to seek medical advice, go to the ER if needed. And then we'll do a couple of questions that we've received in a brief Q&A session. So let's get started. So this side really brings it home why it's important to learn about these things. Number one, asthma is critically important in the US population. It is one of the most common respiratory illnesses that children have, and it affects over 7 million children in the US each year. This is something that is chronic, so it's really, really important because it is so common to understand asthma and how to treat it and manage it. Secondly, RSV. RSV is a virus and it leads to a ton of hospitalizations each year. This is burdensome for not only the families and very scary at times, depending how sick the child is, but also extremely costly to the healthcare system. And then, third, it's really important to have families and parents and aunties, uncles, nanas, pop pops, everybody in the family to be aware of how to manage these medications and respiratory illnesses if needed. So many times they see patients coming into the ER who have these chronic medical issues, but they don't fully understand the medications they may be on or signs and symptoms that they should look out for if they're getting worse. So, this webinar is going to walk you through what you need to know and when you need to seek help. So, this hopefully puts everything in perspective for you. So, what is asthma? I'm going to just give you highlights and kind of pearls to keep in mind. The most basic form of what asthma is essentially inflammation in your airways, in your lungs. Pediatric asthma causes your lungs to get more and more inflamed and basically does not allow you to breathe in and out as normally or as fluidly as you need to. And that's what causes the problem. There are many, many things that cause triggers, things that can cause a flare up, as we typically say in layman's terms, or an exacerbation. Some of those things include allergens, smoke, dust, and even physical activity. A lot of kids have exercise induced asthma, for example. When they're really working hard, breathing really fast or rapidly, that can even trigger a flare. Symptom severity is something that is really critical to keep in mind. Symptoms of asthma can range from just a mild cough or a little wheezing to very, very severe respiratory distress where the child cannot breathe, is kind of gasping, and can even get as sick as stopping to breathe, which can lead to death, unfortunately. So that's why asthma and knowing these signs and symptoms is so critically important. And the last thing I'll highlight for pediatric asthma is healthy versus asthmatic lungs. Healthy lungs are air filled, right? You have your lungs there to allow air to enter into your body so you can get oxygen. It performs all of the bodily functions that we need to live. And then you exhale carbon dioxide. That's how your lungs work. Asthmatic lungs, because of this chronic inflammation, are damaged. And when it's left unchecked and not treated or regulated well with medications and things like that, you can have chronic inflammation that causes that air exchange, that oxygen and carbon dioxide exchange. There are going to be problems which can lead to issues further down the line. So Signs of pediatric asthma. Chest tightness or pain is very, very common. And this is something that is often overlooked, unfortunately, because everyone associates with asthma just wheezing. But especially in little kids where they might not be verbal or they can't explain things as clearly or succinctly as an adult, they might just complain of chest pain or chest tightness, not being able to take a deep breath or feeling like they can't get air in properly. This could be a sign of asthma, and you definitely want to make sure that the child gets checked out and seen by their doctor. Shortness of breath is another very common symptom. Something as simple as being able to get up, walk around, in the child's case, being able to play with their friends freely, keep up with activities, physical activities, sports, all of those types of things. The kid just seems very, very winded, saying that they just can't get a good breath in. That may be a sign of asthma as well. Now, wheezing or whistling, as sometimes people call it, that is something that's very, very common in pediatric asthma. This is something that most people will associate with asthma, that wheezing, very noisy breathing that happens when the lungs are so constricted that you really cannot get around having that noisy breathing because the air is not flowing easily into the lungs. And then finally, and this is another symptom that is overlooked often, frequent coughing. Now, kids get sick all of the time, and it's not uncommon that they're going to pick up a cold, a virus here and there, or even many, many times, especially when they're first starting school and you're going into fall and winter season. This is very common. But if you notice that it is pretty much constant, or especially at night, or you hear them just coughing while they're sleeping, that may be a sign of asthma. So, again, you want to make sure that the child gets checked out to investigate, could this be asthma that they're experiencing if they're having a chronic cough. This is a table I put together to really drive things home for you guys to make it as simple as possible because when I'm in the ER, this is one of the most common issues that comes up. A family knows the child has asthma and they have all these medications and they don't know when to use them or for what reason, how to use them, which is so, so important. It's a simple thing that's preventable to make sure that your child stays safe because, again, asthma is very alarming. When you can't breathe, you can end up dying. And this is something I drive home to all of the families because sometimes it just does not click that yeah, you have asthma, you might not have had a flare in a long time, but you always have to be prepared and know those symptoms to make sure you get your medication quickly. So I'll run through this list for you guys. The intervention, rescue inhalers. This is going to give you immediate relief. This is what you use when you are having symptoms actively coughing, wheezing, shortness of breath, feel like you can't catch your breath, all of those symptoms that come on, and it can be sudden or even triggers, like I mentioned, smoke, allergens, things of that nature. So you want to make sure that you always, always have a rescue inhaler with you if you do have asthma and a mask and spacer. Those chambers allow you to get the medicine in correctly so that it gets down into your lungs. A lot of people don't have these. And basically, if you have an inhaler and you're not using a mask or spacer, the medicine, most of it, just goes into the back of your throat, which is not where you need it to be. So you always want to make sure that you have a mask and spacer so that you can breathe it in fully and have it get down into your lungs. That's critically important. And especially even for the teenagers. A lot of the teenagers I see do not have this. Make sure you speak with your doctor to get a mask and spacer for your inhaler. So that's number one. The second, controller medication. Now, controller medication is for daily management. Daily means every day. It doesn't mean when you feel like it. It doesn't mean if it's a full moon. No, you need to do it daily, every single day. The reason why this is so important is that this category of medications takes time to take effect. It is not instant like a rescue inhaler. So, in order to get the best outcome, you got to take it every day even when you're feeling great, because when you're feeling great, you want to keep feeling great. And that's why you should continue your medication every single day. I know it's a bummer sometimes to think about you have a medication that you have to be taking all the time, but think about it this way. You are doing the best that you can to prevent a flare up or having to land into the ER or worse, get hospitalized or have a really bad outcome. So, controller medications mean taking it every single day. Intervention, the next one, avoiding triggers. This is so important because the outcome is preventative, right? You want to be proactive to try to manage your asthma and stay as happy and healthy as possible. Now, parents, I know that this can be challenging because as the kids are growing, they're more independent, they have more autonomy, they're going to be doing their thing. But whenever possible, keep in mind avoiding those triggers. For many people, those are allergens, so like pollen, dust, mites, anything like smoke or inhalants that can be irritating. Even cleaning fluids sometimes that are aerosolized and put into the air can be an irritant and trigger an asthma exacerbation. So, whenever possible, try to avoid those allergens so that you do not have a flare up. And then the final one that is so, so important is regular checkups. If you have asthma, that means you have asthma for life. It may get better, it may get worse, but you always will have asthma for the rest of your life. This is something that is really lost on families sometimes because they'll say, I see a 14-year-old and they'll say, yeah, he used to have an inhaler and some medications he took, but he stopped taking them when he was maybe 7 or 8. That's great. I'm glad that he's been doing well for the past 6 or 7 years, but you always have to remember that an asthma flare can happen at any time. So you want to be prepared. So regular checkups, making sure that you have proper prescriptions and proper medications, making sure things are not expired. And so important with kids as they grow, you got to change the dosing of the medication. The amount of medicine you're going to take when you're 3 is going to be very different from the amount of medicine that you take when you're 15. So, regular checkups to manage your asthma, even if you haven't needed to use your rescue inhaler for a long time, is so, so important. So, please make sure that you get that done and have that scheduled always to make sure that you're doing the best that you can. Next up, let's talk about RSV. RSV is a virus that, in the past few years, especially as we were in the thick of the pandemic, coming out of the pandemic, a lot of people heard about it because there were so many hospitalizations, because people were getting flu, RSV, COVID all at the same time, especially in the pediatric population. So, RSV is just one of the dozens and dozens of viruses that can cause bronchiolitis, but things that are unique to RSV we'll touch on very quickly. It is very contagious, just like all viruses, meaning that it spreads through coughing, and especially in really crowded environments. So, daycare, schools, things like that, it's very contagious. You can have severe complications from RSV, especially in the younger babies, and also if you have chronic medical issues, just like anything, it would be worse, unfortunately. RSV typically has cold like symptoms, and so cough, runny nose, and all of those types of things that we'll get into in the next slide. So, common symptoms of RSV, just as you would think a respiratory illness. So, you can have lots of cough, congestion, mucus production, runny nose. You can even have wheezing and breathing difficulty. This is something that we see very commonly in kids where they don't have a diagnosis of asthma, but when they get sick with these bad chest colds or bronchiolitis, sometimes they may have wheezing or noisy breathing. That does not necessarily mean that they have the diagnosis of asthma, but sometimes they do have wheezing with a respiratory illness, and that is something that we see in children very commonly. Next, you can have fever. And when you're feeling pretty crappy, you have a fever, you're coughing, you're congested, it's normal that you're not going to want to eat as much as typical. This is something that can lead to trouble in terms of dehydration, especially for the young babies if they're not able to kind of coordinate sucking and swallowing to allow them to feed at their normal capacity. So we always tell families you want to make sure that you are monitoring how much the child is taking in and feeding, as well as wet diapers, something that's objective to determine how hydrated they are. That's really, really important. And the final component is just recognizing these symptoms to monitor to keep them on track. If the child is getting a little behind and might show signs of early dehydration, you want to address that right away so they don't get sicker. So, how can you manage this at home? RSV, depending on the age of the child, can be managed at home and how sick they are. Simple things I always say to parents: make sure you have some type of suction device. So that means a lot of people are familiar with the blue bulb suction that you can pretty much get from any hospital or clinic that is made available, the blue ball suction. You can also get so many suction devices, electronic even or battery operated, suction devices from all of the big box stores. So, CVS, Walmart, Target, all of those you can get. One of the most common ones is something called Nose Frida, and it has a little bit of tubing that you can use to really suction. It's really important to make sure that you use some saline. Saline is basically just salt water, so it loosens up the mucus so that you can kind of get a little bit deeper in there to make sure that you're able to suction as much as possible. Again, with the little babies, you want to make sure that they are staying as hydrated as possible and keeping track of how many wet diapers they have to make sure that they're not getting dehydrated. All right, so now we're going to move on to our next topic. The flu. It is flu season. We are in the thick of it. So I always want to talk and touch on flu because people have understandings of it that are slightly different, but it's here with us year round. But obviously, in colder winter months, the respiratory illnesses are a bit more intense. So you want to think about those areas that you can help manage and mitigate in terms of getting really, really sick. So, symptoms of flu, just like any other respiratory illness, are the things that you would think about. You can have definitely fever, and typically it's pretty quick onset, very sudden. You can have chills, just body aches, cough, congestion, muscle aches, and even some stomach features. So, sometimes people have like abdominal pain or vomiting or even diarrhea when they're sick with the flu. Flu, just because it is a virus, as we spoke about with RSV, for example, it is very, very contagious and it is easily spread, especially in tight spaces, which you would find in school settings or like workplaces and things like that. The severity of the illness really depends on if there are chronic medical issues for the child. Anyone with chronic medical issues who might have issues with their immune system are going to get sicker typically than someone who's healthy without any issues at all, just like any other illness. So you always want to think about preventative measures. Now, flu is one of those things where we do have a vaccine every single year. And I know this is a sensitive subject for everyone, but I think about vaccines like this. A vaccine is something that's going to protect you from getting very, very ill. It does not mean that you will not get the flu, for example, when you think of flu vaccine, but it means that you will not get critically ill. The vaccines are tailored to make sure that people are still going to be functional and try to avoid hospitalizations or getting very, very sick from the illness. So that's why you want to get the vaccine. And this is really important, especially if you're around older people. So, for example, myself and my friends, thankfully, most of us are still healthy without any serious medical issues. But if you're around your grandparents or your parents very often, you getting vaccinated helps protect them because as you get older, you're going to have a more severe response to flu illness. So it's again something that's protective for yourself and those around you who are more vulnerable. The reason why each season you need to get the vaccine is that each season the flu and the ones that are kind of going to be the major players that season changes. So I liken it to like Fashion Week, right? You have Fashion Week and you have your lineup for the fall, and the styles and flavors, all that stuff changes every single year. So you have to adapt, and that's how the vaccines are. That's how the viruses perform. So one year, one virus might love red, the other one might love blue, if you're thinking about it in a fashion sense. And the vaccine has to be adjusted and tailored for those viruses that have changed over the past year. So that's why every single year you need to get a vaccine because it's tweaked and adjusted to match their best guess for what is going to be the most powerful, the most prevalent, the most common type of virus that season, that particular time of year. So, other symptoms that might be overlooked with the flu, we spoke about the fevers, we spoke about chills, coughing, congestion, all those things, body aches. But sometimes you can even have like sore throat. A lot of times you can also have just general fatigue and what we call malaise, meaning you just feel crummy. You don't have energy and you don't have that ability to really perform or do your usual stuff. So, all of those things are symptoms of flu. And if you're feeling that way, it may potentially be the flu. So, how do you manage the flu? Again, the flu is a virus, and there are things that we broke out in two categories: home remedies and then medications. So, home remedies are what you would think for any respiratory illness. You want to get plenty of rest. Rest is so important because it allows your body to start healing. It's really important for your immune system to be able to get that time to rest and heal as it's fighting off the virus. The second thing is dehydration. If you're feeling really crummy and not eating or drinking as much, you can get dehydrated. So it's so important to make sure you're getting plenty of fluids in to make sure that you stay hydrated and not run into issues. And then things that you can just have in your house, especially during any respiratory illness, would be like ginger or echinacea. Ginger is great for boosting your immune system. Vitamin C, echinacea, all those types of things are more or less harmless, especially when taken in appropriate quantities. So things like that can really help you that you have access to all of the time. In terms of medications, you can get over the counter medications. There's decongestants for a certain age appropriate, especially like the teen and older young adolescents and things like that. We do not recommend decongestants in young kids just because they can have some adverse effect, and you don't want to worry about that. Other things that are very, very common would be like ibuprofen or acetaminophen if you're having the muscle aches, the pain, the fevers. All of that is perfectly fine to take from over the counter. Okay, we're going to wrap up our virus whirlwind with COVID 19. Now, COVID 19, all of us are familiar with it now since the pandemic over the past several years and when it came onto the scene. In children, it presents in very common ways, but also I'm going to leave you with a pearl in terms of it being asymptomatic, meaning sometimes children do not even show symptoms. So you can have the classic symptoms of any virus: fever, cough, congestion, trouble breathing. You can have, which we found with COVID, that loss of smell, which was very common in a lot of people, sometimes even affecting your taste. You can similarly, just like the flu, have fatigue and headaches. We've seen this with long COVID. A lot of people just have kind of chronic fatigue that they cannot shake, and it can be very, very debilitating. You can also have stomach issues, abdominal pain, nausea, vomiting, or just not being able to keep anything down at all. And also, as I mentioned, a lot of children can be asymptomatic, meaning they do not have any symptoms at all. This can be really tricky because kids are running around, they're getting into everything. So when they're at school or playing with their friends and things like that, and they're not having any symptoms, it's hard to track. And that's why, again, I'm going to plug for vaccinations because if you do not have any symptoms, it's hard to know when you're sick. And if you don't know if you're sick, typically people are not going to take preventative measures. The vaccines, just like I mentioned with the flu, COVID has had tons of mutations since it came onto the scene. And so each year that vaccine is slightly tweaked to match the mutations that the virus has had over the past season. So when you get vaccinated, again, it's going to be protective not only to that person, but the people around them. So you think about people who may have cancer, who have immunocompromised issues for a whole slew of issues that could be medically related. So again, this is really something that's so important to make sure that you are staying protected, but also your family and your community is staying protected because it's going to help decrease the rates of getting very, very sick or getting hospitalized. Again, it does not guarantee, nothing is 100%, including vaccines, but it's going to help you to avoid those very, very sick illnesses that can happen with COVID 19 to make sure that you can stay out of the hospital, stay out of the ER as much as possible. So, managing COVID 19, these are things that all of us are very well versed in now. But basically, now that we are several years out of the pandemic, it's common sense measures that you want to do, especially just when you're sick. So, if you feel super crummy and you know that you're sick, you know that you've contracted COVID 19, try to stay away from people as much as possible, especially if they are immunocompromised or have some chronic medical issues or are older. This is something that we've known, and you should do that whenever possible. The next thing is if you can't isolate yourself for a bit, just like if you were sick with any other virus, use your mask. The mask is still here. It's very simple. You can get them anywhere. They're very, very cheap right now. But even that small barrier of protection, using that mask helps when you're trying to keep all those airway um, droplets and respiratory droplets out of the general population if you're coughing. So using your mask when you're out and about is so, so important if it's COVID-19 or flu or any respiratory illness, just so you aren't as contagious as you can be. Seek medical attention is so important if you are getting worse. So this could be a whole slew of things, having trouble breathing, high fevers, any signs of dehydration, or you just feel really off and you don't feel like yourself. So you want to make sure that you are doing this and keeping tabs really on your own body to make sure that you're not getting worse or your child's not getting worse. So, preventative measures for respiratory illnesses. One of the things that I've driven home is vaccination. I hope you all think about that seriously because it is proven to be safe. This is something that has been done for decades and decades, and each iteration gets better and better. So it's protecting yourself and your family and your community. So I always recommend vaccinations whenever possible. Other simple things that you can do: good hand hygiene. This is something that was really interesting when the pandemic started because they saw it really uncovered how many people at baseline have bad hand hygiene. You think about it, I'm a physician, so I wash my hands constantly, especially when I'm at work. But most people were not doing that. Most people think of, okay, I'll wash my hands when I go to the bathroom. Yes, that's great, but you should be doing it more often than that. You should be doing it before you're eating, whenever you're transitioning spaces. You think about you're out and about all day, you're touching all of these surfaces that have been in contact with tons of people, especially if you live in like a major city like New York or something like that. It's literally tens of thousands of people who are running in and out of the subway, for example. So, washing your hands frequently and thoroughly and often will help stopping the transfer of all of those germs that we know are on people's hands. The other thing that's so important is avoiding really crowded places. Now, this is not as critical as it was during the pandemic, but just use common sense. If you're really sick, if you feel really crappy, if you feel like you can't even get out of the bed, odds are you should probably stay home if possible. And I know this can be challenging, especially with kids with school and you got to get doctor notes and things like that, but really try whenever possible if you're feeling that sick to avoid crowded spaces so that you limit your interactions and therefore limit the spread of this virus when you are sick and contagious. So, when to seek help? We're wrapping up, but I did want to touch base on this. This is something that is so, so important because sometimes people, they want to tough it out. But I always say, rather safe than sorry. So, with any respiratory illness across the board, if you are having severe trouble breathing, like your child is struggling, breathing very rapidly, saying they can't catch their breath, anything like that, you want to seek medical attention. The next thing is prolonged high fevers. Now, some people say, what exactly does that mean? I always say if the fever in an otherwise healthy person, a healthy child without any chronic medical issues, they're fully vaccinated, they're otherwise healthy. If the fever is lasting longer than 3, 4, 5 days in a row and they're high, like anything 103, 104, high like that persistently, odds are you want to get it checked out, especially at the 4 or 5 day mark. And then the third component with these respiratory illnesses and any illness really is if you are having severe fatigue or confusion, if you are altered in any way, as we call it in the medical field, meaning that your neurologic baseline has changed in some way, you're disoriented, anything like that, the kid is, seeming really, really out of it. You want to seek medical attention because something more serious may be going on. They could be dehydrated. So all those things come into play. So you want to make sure that you get checked out as soon as possible and just err on the safe side. Call your pediatrician, call your primary doctor to make an appointment as soon as possible if you are running into issues. If you're not able to get in with them, you go to your nearest ER, just as you would just to get assessed to make sure nothing more serious is going on. All right, so we're going to take a little pause. We've received some questions, and we're going to we have a good amount of them, and I'll just read them aloud for everyone, and we'll go from there. So, first question in says, "How can I tell if my child's asthma is getting worse during the winter months?" This is so, so important. So, our program for asthma is longitudinal on parent partners, and it's something that you should absolutely join because we walk through the signs and symptoms that you may be experiencing. So, having an asthma action plan, for example, is so important. It outlines the symptoms you're having, what medications you should take, and when you should seek medical attention. If your child's having lots of coughing, needing to use their rescue inhaler much more frequently, you can see that their breathing is getting worse. You want to make sure that they seek medical attention right away. So, this typically happens in the winter, and you want to make sure that you have all of your equipment. And our program for asthma goes through all of this. We go over asthma action plans, we go through how to use masks and spacers, we go through when to seek medical attention, and also even have peak flow meters so you can monitor and track how your child is doing from the comfort of your home. So joining the asthma program for parent partners is going to be super helpful. It's like having your own personal asthma specialist in your phone. Next question. What are the best ways to prevent asthma attacks triggered by cold weather? Very good question. So, depending where you live, the kind of simple preventative measures you can do are those regular checkups I spoke about, making sure that you have your medications appropriately dosed and that you know where they are. The second component is if you do have a controller medication, make sure you're taking it regularly. A lot of times people fall off during the summer because they're feeling better, they're more active, but you want to take it regularly every single day to prepare you for those colder months where asthma can flare up more. So we speak about these kind of nuances a bit more in our program for asthma for parent partners. So you want to make sure that you join to get more details about how you can manage asthma in colder months. All right, next question. How do I differentiate between a common cold, the flu, and early signs of an asthma flare? This is a really good question and very common. So, depending what's going on with your child, if you know they have a history of asthma, for example, all of these things can look the same at the beginning. And the key, especially with an asthma flare, is recognizing and treating it as soon as possible. Now, you can have a virus that triggers an asthma flare, for example. That's actually one of the most common things. So, your child could get flu, for example, have some fevers, have cough, congestion, and that can then spiral into an asthma flare. So, all of those things can be true at once. And the key is really knowing your asthma action plan that we go through in the Parent Partners program for asthma, for example, and then knowing when to give those medications. If the child's having a lot of trouble breathing, shortness of breath, all of those types of things. This is a really good question because all of those things can be true, and you want to know how to manage them and make appointments with your pediatrician as needed, as we speak about in the program. All right, next question. Can respiratory infections like the flu or COVID 19 worsen my child's asthma? If so, what should I look out for? The short answer is yes. What we find is that children with asthma do have, it's a comorbidity essentially, right? It's a chronic medical issue. And so this does worsen their response typically when they do get sick with flu or COVID 19, for example. So, given that is the case, you want to make sure that you're watching these symptoms very closely. How are they breathing? Do they need their rescue inhaler? Do they have their controller medication and are they taking it appropriately every single day? Seeking medical attention. I always tell families again, err on the side of caution. No one's going to be upset with you if you come into the ER or make an appointment with your pediatrician when your child's sick, because kids with asthma tend to get sicker when they have these respiratory illnesses such as flu or COVID. So you want to look out for the cough and congestion, the trouble breathing, the wheezing, and anything that makes you concerned that they're actually having shortness of breath and unable to keep up with their respiratory system. So that's a really good thing to keep in mind as well. Last question we'll do here. What precautions should I take if my child with asthma contracts COVID-19? This is very important, and I'm going to beat my drum a bit about vaccinations. That's something that you can do, simple, and it's readily available. If you know your child has asthma, get them vaccinated to the flu, get them vaccinated for COVID 19. Thankfully, and I forgot to mention this earlier, they even have vaccinations for RSV now, especially for like preemie babies. So, getting vaccines is really, really critical to help prevent those severe respiratory illnesses in kids, especially those with chronic medical issues such as asthma. So, with that, I'm going to leave you guys with the Q&A. We have some more, but I want to make sure that we're able to move along with the rest of the content. So, finally, I just want to bring things to a close. Parent partners, we're dedicated to making sure that families and parents get health education that is vetted, is evidence based, and supported by medical professionals. This app allows you to get not only medical content, but to chat with different medical professionals asynchronously on your time. We do webinars like this. We also are doing group sessions so that you can get direct information from a medical professional like myself. We want to make sure that in the age of social media that you get the proper information at the right time. We know that it's really hard to get access to primary care doctors and pediatricians sometimes. Everyone's overworked, everyone's really stretched thin. So Parent Partners really focuses on making sure that you guys get that proper medical information when you need it. So that being said, subscribe to our channel, Parent Partners on YouTube. We have all our content there. Check us out on the web at www.parentpartners.co. You can see all of our content and download and sign up for our programming for the app as well as asthma. We have mental health services. We have programming on childhood obesity, all of those things that are really important to your families to make sure that they're staying safe and able to grow to be happy, healthy adults. Follow us on IG at My Parent Partners, where we have a lot of content and short video as well. And then the final thing I want to leave you guys with is I'm so excited to announce that we have our ebook all ready for respiratory illnesses. It's called Breathe Easy, Not Wheezy. This ebook is going to lay out step by step and even in more detail than what we covered tonight respiratory illnesses, especially focusing on asthma. What do you do in certain situations? How all of these factors come into play, how your body responds to asthma flares, medications you need, asthma action plans, the list goes on and on. So the ebook is something I'm so proud of. I'm glad that we have the product out to help you and your families better manage asthma and take care of your child. So with that, I'm going to leave you guys. Make sure you subscribe. Parent Partners on YouTube. Find us on IG at My Parent Partners and check us out on the web again, parentpartners.co. Get your ebook. This is a fantastic way where you can stay up on your medical knowledge, feel really empowered to know what's going on with your child, and understand how you can make sure that they have a happy, safe childhood and grow into fantastic, wonderful, productive, awesome adults. Thank you so much for joining us, guys. It's been a pleasure. This is Dr. Alana, and I'll see you next time on another webinar. Take care.